Hi there, I'm Dr. Chung. Welcome to your friendly proctologist. In this video, I'm going to be going over instructions, things my patients need to be aware of if they're having surgery with me. If you're not having surgery with me, that's okay. Maybe you'll get something out of the way that I consult or give advice to my patients how to do a recovery. I will give you a big warning if you're not having surgery with me, okay? Please see your surgeon, speak with your doctors about how these medications should be taken and what your surgeons and doctors are comfortable with or what their recipe is for controlling pain. I actually call my patients 1 to 2 times a day. I monitor them personally very closely. So some of these medications and the recommendations I'm giving in this video may and might be dangerous for you to follow. For example, some of these high-powered narcotic medications might be at a very high dose for you, and no one is monitoring you and taking care of you and making sure you're doing okay. It can be a very dangerous situation, one with potential overdose or complications from my recommendations. Okay, so I highly suggest that you speak with your doctor. My patients have direct access to me and I keep track of them once again. So my patients are very safe because I keep a very close eye. Again, big warning, please consult with your doctor. Alright, so let's get through with the instructions. And I've got an instruction sheet here. So number 1 is diltiazem. This is the cream you picked up from the compound pharmacy. And this cream is to be applied to the outside of your anus 4 times a day. So once you get up in the morning and once before you go to bed, 2 more times during the middle of the day. This cream works by relaxing your muscles so that your anus can open up just slightly here, and then you can get more blood flow to your anus, okay? Because your anus wants to squeeze extremely tightly after recovery because of the pain, so we want to try and prevent some of that. You want to just use a very small dab, like a green pea, half the size of that. Just a small dab of the cream, put it on the outside. You don't need to rub it in everywhere. And then close your butt cheeks and you're done. The next one, number 2, is preparation H with lidocaine. And the lidocaine is what we're after here because lidocaine is a numbing cream, a numbing medication to help with pain. I'll be honest though, this medication doesn't work very well for bottom end surgeries, so it's something that if you want to try it to find out if it helps you, definitely go for it. And you can apply this every time you put on the diltiazem, the cream number 1. Number 3 is we're getting into the prescription pain pills. You're going to pick up 2 medications. One is called Percocet and the other one's called Tramadol. Each of these pills can be taken 1 pill every 3 hours or 2 pills every 4 hours maximum, okay? Any more than that, you can have issues with your liver because of the Tylenol in the Percocet. And either way, we're going to be monitoring. I'm going to be monitoring you, giving you a call so that we can make sure your pain is controlled, but also so that your side effects of the medication don't start to interfere and make more problems for you. So the Percocet has Tylenol in it and oxycodone, which is the narcotic component, okay? And the Percocet I need to make you aware of is that you need to make sure you stay under 4,000 milligrams of Tylenol in 24 hours. Tylenol can be toxic when you go over that 4,000 milligrams. Your liver will start to get sick and it can land you in the hospital. It's not good. So I always tell you, do not take regular Tylenol when you are taking Percocet. Because usually when you take regular strength Tylenol, the bottle will say take 2 tablets, which can mean anywhere from 1,000 milligrams to 1,250 milligrams, depending on how big that tablet is. So if you're taking 3 times of Tylenol in the day with each meal, you can end up with over 3,000 milligrams of Tylenol. And then if you want to take Percocet because your pain is bad, you've locked yourself out of it. You just can't take as much Percocet. And I'm telling you, Tylenol sucks. Absolutely is terrible for bottom end surgery. It just does not work, okay? So Tylenol's not worth it. The Percocet is the one you want to take, especially early in their recovery, okay? But again, I will be coaching you how to take Percocet and Tramadol, and we will see how your recovery goes, okay? But I advise you to pick up both of those from the pharmacy. The next medication is ibuprofen. And ibuprofen can be a really helpful drug and in combination with everything that we talked about, okay? But I ask you to hold off on that medication for 2 days. The reason being is get very concerned about bleeding complications so soon after the surgery. And yes, while I do use stitches and make sure that you're not bleeding afterwards, I don't want things to open up or cause issues. So usually about day 2, I will be talking to you and saying, okay, let's try some ibuprofen at this point. But again, it's safe to take ibuprofen, Percocet, Tramadol, and all the creams together at once, okay? The next thing we're going to talk about is stool softening. Very, very important. And I will be calling you and making sure that we tune and fine-tune the amount of Miralax that you're going to be taking. Definitely on the day of surgery, I'm going to advise you to take another cap full of Miralax, just like you did on the day before surgery. But again, we want to wait till after you get home from the surgery. Don't take Miralax again on the day of surgery. And I'm going to be making sure that you poop within about 3 to 5 days from the surgery date. If we wait longer than that, you can get really constipated and have a lot of problems pooping. Okay, the worst horror story is that you have to go to the operating room again and I have to scoop out your poop for you because you're not able to get it out. So don't want that happening, okay? That's for the medications. Again, you don't need to memorize any of this. This is just to familiarize yourself and you know what I'm talking about when I'm saying Percocet, Tramadol. It's like, oh yeah, I've got that. Okay, I'm going to be helping you. Don't worry about the dosing. It's all good. One thing I'm going to mention about the pain here is we want to be ahead of the pain. Many people will tell you, like nurses, doctors alike will say, wait till the pain gets bad, then take the pain medication. And I disagree with that, okay? With me, you're going to actually take pain medication at a steady pace. And we're going to make sure that your pain stays under a 5 during this recovery, okay? Because if we keep the pain medication flowing at a constant rate, it's much easier to keep that pain level down, okay? If you start shooting up with the pain and then you take the medication, well, it takes 1 hour at least for that pain medication to kick in. But the thing is, by that point, the pain is going to be even higher, maybe 8 or 9 out of 10, which is a lot of pain. And that one pill of Percocet, no, it's not going to cut it at all. And you're going to end up trying to take a lot more pain medication. And the thing is that there's a limit to how much you can take at once. And I promise you it's going to take a lot more pain medication, more side effects, and you're not going to feel as good. So again, I'm going to be coaching you on this, telling you what to do and how to figure out what to do, what to take, when to take it. And for those of you who are not having surgery with me, please speak to your surgeon because someone needs to be watching out for you, okay? Someone needs to be carefully watching you so that you don't have problems with medications. Okay, done. Getting off my soapbox now. Activities. What can you do immediately after your surgery? Well, I suggest that you take things very slowly. I do want you to sit up, to stand up, and walk around for a little bit, day of surgery, the next few days. But I don't want you to be walking a 1/4 of a mile. You know, I don't, because the thing is the wounds are very raw in your bottom end, and if you do a lot of walking, those wounds will rub against each other, and you're going to feel really sore. You can get bleeding issues, and you're going to not be happy. It can make the pain go up, okay? So take things very slowly, even if your pain is very, very low, which it probably will be, okay? And I want you to keep feeling good. I don't want you to test things and then start feeling bad, okay? All right, so keep the limitations going for about 2 weeks, okay? Even if you feel good, please don't go and do a big day at the park. It's just going to, you're not gonna like what you feel afterwards. Don't lift anything more than 10 pounds, okay? And because you don't want to get the blood rushing to your hemorrhoids and then cause more issues. Walking and stairs are okay to do. I recommend you do some of that a few times a day, but very short intervals, short distances, okay? After 2 weeks, you're going to feel a lot better, and then you're going to start increasing your activities very slowly. Okay, how do you take care of yourself? Well, I recommend that once you leave the surgery center, that counts set the timer for 4 hours. Go home, and then if you're tired, you can just pass out, go to sleep. If you want to stay up, go ahead and just sit on the gauze pads that we have done for you in the surgery center. And then at 4 hours, go ahead and just remove all the bandages and the tape, okay, that may be stuck to you. And then take a sitz bath, go ahead, take a shower. It's okay to put soap in your hair, it's okay to put soap on your bottom end, get your bottom end all wet. You can soak, no problems whatsoever. You can use any soap you want, bath salts. Again, you get the point there. Once you come out of the bathtub, gently dry everything off, and then you start putting the creams on. Diltiazem, Preparation H with lidocaine if you want it to be, okay? Don't forget to take your Miralax at some point with a meal after that. And if you're having a bowel movement, that's the best time to take a shower, okay? Or a sitz bath to get everything wet instead of wiping, okay? Warning signs, and this is more specifically warning signs of an infection, okay? Pain is the first thing that usually gets worse, and it's usually a very steady curve, and it kind of creeps up on you. It's pretty insidious. But in the beginning of the pain recovery of a hemorrhoid surgery, the pain is going to be the worst, and it gradually will go down with time. But with an infection, the pain will start to curve upwards again. And so you'll find that the pain medication doesn't really work. You find that the usual pain amounts, yeah, it's not controlling the pain. I still feel like the pain is even getting worse. That's the time you need to let me know and make sure I'm kept in the loop. Okay, you may see redness on your skin that's kind of spreading out from the center of your anus like a wildfire. Okay, number 3, like you can't pee, and number 4, you get fevers. Number 3 and 4, fevers and can't pee, those are very late signs of infection, and you definitely will have pain that is out of this world insane. Okay, if you have any of these signs, please call me right away. I need to see you and make sure you're doing okay. All right, so bleeding and discharge is going to be very normal after the surgery as well. You're going to be changing that gauze out between your butt cheeks every 2 to 4 hours, and just keep things changing, keep things dry as much as you can with that gauze. It's going to be very helpful. But I'm going to be seeing you 2 weeks after your surgery, and of course keeping track of you every day so that you are well taken care of. You're going to be in great hands, and I promise you we're going to keep your pain under control. And again, the goal is less than 5. So I hope this helps you. If you have any questions, always feel free to text me or call me, and I'll be seeing you very soon in the surgery. Bye-bye.